Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, May the 10th, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, good afternoon and thank you, Brad. I want to start off today by acknowledging that it is Nursing Week here in Toronto and indeed across Canada. This is a week, should be every week, but we have a week set aside to recognize and honor the contributions of nurses who, of course, work tirelessly to provide care to people in hospitals, in care facilities, and in the community at large. And we should say it every day, but this week in particular, we are thanking and honoring registered nurses, nurse practitioners, registered practical nurses, nursing students, working in all settings, including public health nurses. The pandemic has shown us the courage and the commitment that nurses provide every day, and it's highlighted the crucial roles that nurses undertake. Nurses have been on the front lines of this pandemic for more than a year now, and they've been a source of inspiration and resilience and hope. And we want to acknowledge as well the effort and the energy and the courage that it is required for them to do their jobs. I'm sure, like a lot of people, but in particular, they must be fatigued by now, but we encourage them and love them and want them to carry on doing the excellent job that they can do. And I think one of the best ways in which we can help nurses in their efforts against the fight against COVID-19 is to continue to follow public health measures and to get vaccinated as soon as we become eligible. Speaking of vaccinations, Team Toronto has now distributed more than 1,445,809 doses of COVID-19 vaccine. More than 50% of eligible Toronto residents are now vaccinated. We passed that threshold this weekend, as noted. And as Chief Pegg will detail shortly, this week will be our biggest and busiest dose administration week, with more than 98,000 appointments in our city-run clinics alone. Thank you to all of our hospital and healthcare partners who are working with the city and with community organizations to get Toronto residents vaccinated. This work over the last several weeks has included a focus on our hottest hotspot postal codes, and it is making a major difference in our fight against COVID-19. To cite two examples from the numbers as to the progress we are making and the momentum that we've developed, first, in the 13 hottest hotspot postal codes where there were very low rates of vaccination, we have gone from under 15% vaccinated as of April the 5th to more than 40% as of May the 2nd. And across the city, while it took us from late last December, when the first doses arrived, to May the 1st to get to 40% of eligible residents vaccinated, we have in the past week gone from 40 to 50% plus, with the momentum and capacity to carry us, supply permitting, to beyond 65% in the next 21 days. So that's the kind of momentum that we've developed with all the efforts of all of the people that have been involved, and of course with the cooperation of some degree of increased supply. Our thanks go to every single resident who has stepped forward to get vaccinated when they became eligible. And of course, this is a non-stop effort. It is about saving lives. It is about getting life back to normal. It's about hope. It's about summer jobs. It's about family. And it's about good health. We are now laser focused on getting, as a city, to Premier Ford's new target for the province of 65% of eligible adults vaccinated by the end of this month. And our vaccination numbers are going in the right direction, and so too it is the case that our COVID-19 case numbers are going in the right direction as well. Dr. Davila will outline today that the province-wide stay-at-home order is having an impact on stopping the spread of the virus, all the more reason to really double down individually and collectively on following public health measures. Our vaccination efforts right now are being helped by additional vaccines supplied by the Government of Ontario, who in turn receive vaccine from the Government of Canada. As more vaccine shipments have come in from manufacturers, the province has allocated additional vaccine supply to hotspots in Toronto and other regions so that we can focus on the areas hardest hit by COVID-19 and make a real difference in vaccination rates in these areas, as I mentioned earlier. It is a good example of the City of Toronto continuing to work cooperatively with both of the other governments to help people and to help us all get through this pandemic. I want to thank the federal and provincial governments for continuing to work with us, which they are both doing, in order that we can save lives and get through this very difficult and challenging third wave. I know people are anxious right now, and they want clarity about what comes next and when. I do too. That is why today the GTHA mayors and chairs asked the province to provide predictability for the current provincial stay-at-home order and what is to follow. As the Victoria Day long weekend approaches, people and businesses have begun to ask perfectly reasonable questions as to where things will stand as of that time, so that they can make plans of all kinds, whether it be business plans or personal plans. Accordingly, we think it is important that the Ontario government communicate clearly and as soon as possible whether or not its order will be extended further or modified based on public health advice. This kind of predictability will help people and businesses plan for the near future, and it will help to further manage expectations. I can tell you that we are focused on what comes after this stay-at-home period, whenever it may end, and how we can open up in an orderly and predictable way. I am engaged in a number of ongoing discussions with the business community, including the Toronto Region Board of Trade, and within the city government itself, about how we can reopen safely and how we can, over time, restore confidence in coming back to work and coming back downtown when the time comes. I want to make sure that when health officials allow for a safe return, that we are ready. I will have more to say about this in this ongoing work in the days to come, but I really just want people to know that that work is, in fact, underway. I want to recognize today the ongoing work that our parks and facilities people are doing to support the Team Toronto vaccination efforts and the ongoing fight against COVID-19. 4 of the 9 city-run immunization clinics are in parks, forestry, and recreation sites. 14 parks, forestry, and recreation sites are being used for local health agency immunization clinics, with a total of 632 days booked across these locations. And in thanking them, I also thank the public, who to some extent, because of the closure of these facilities, not entirely due to vaccinations, are of course going without the use of those facilities, which we hope they'll be able to use again soon. But in the meantime, they are being put to good use for this very important purpose. 29 City of Toronto parks, forestry, and recreation sites are used as COVID-19 testing locations, with a total of 721 testing days booked across these facilities so far. Thank you to all of our city staff, because it's the staff who normally would be operating these sites for your benefit, for recreational and other purposes, who are keeping these buildings up and running so they can help our pandemic efforts, and ultimately, thanks to these efforts, allow us to get it to a place where we can reopen these buildings and facilities for residents. I also want to recognize the Toronto Public Library System, which has offered to host public pop-up vaccination clinics at suitable library locations in COVID-19 hotspots. 60 of Toronto Public Library's 102 locations, 58% of them, are located in designated COVID-19 hotspots. These branches, of course, are currently closed to the public, other than providing curbside service, and we know these locations are seen as trusted, safe spaces by the local residents. This work, trying to sort these things out with Toronto Public Library, is ongoing, but I'm confident we will soon see pop-up clinics at some of our Toronto Public Library locations. And I want to say that Toronto Public Health has shared the library's offer of space and support, together with the list of potential Toronto Public Library hotspot locations, directly with the Ontario health teams that are providing these vaccine clinics in local communities. I want to thank the Toronto Public Library staff as well, and the workforce there, who continue to be excellent partners. It's another example of how every single part of your city government can work together to fight this virus and to promote a successful vaccination campaign. And on that note, I'd like to ask Dr. Davila now to provide an update on the COVID-19 pandemic in our city.
Thank you, Mayor Tory, and good afternoon. And let me echo the Mayor's greetings of Happy Nursing Week to nursing colleagues everywhere, but especially those with whom I'm privileged to work at Toronto Public Health. Today, I'm reporting 2,529 new cases of COVID-19. I remind you that when we report on Mondays, the case count figures include all cases since the report on Friday. so this averages to 843 cases daily. 1,095 people are in the hospital. 269 people are in the ICU. And I'm saddened to report 37 lives lost to COVID-19 in the last 3 days. As of yesterday, over 1.4 million doses of vaccine have been administered in Toronto. As you heard, we are on track to meet and even exceed our next goal of first dose vaccinations for 65% of Torontonians 18 and older by the end of May. As the vaccination efforts move forward, we are positioning ourselves to enjoy, in time, increasing flexibility and normalcy in daily life. We are seeing this in places like the United Kingdom, which is ahead of us in the delivery of vaccines and has lived within the limits of a strict lockdown for many months and is now transitioning out of it on a phased basis. We too are moving in the right direction, incrementally. These are the facts that define the state of COVID-19 for us in Toronto. Our 7-day moving average for new COVID-19 cases is 963. To describe the situation another way, the latest rate is 262 cases per 100,000 people per week. The good news is that this is the third week in a row with a decline in cases per 100,000 people. But it is still well above the peak from Wave 2, when it was 244 cases per 100,000 people per week. We are starting to see signs for cautious optimism with small decreases in our case numbers. The reproductive number is now below 1. That means spread is slowing. The imposition of the emergency brake on April the 3rd has already resulted in more than a 43% reduction in transmission. Data that show how our population moves about, or mobile device time at home, showed a modest swing toward more time spent at home, from 77% at the end of March, following the move to the gray zone, now almost back to 80% following the emergency brake and stay-at-home order in the beginning of April. Yet we still face new daily cases in Toronto close to or above 1,000 a day. This reflects the nimbleness and infectiousness of the variants. We face a much different intruder than we used to. Toronto Public Health has looked at projections from modeling as we approach June, taking vaccination and variants of concern into consideration. Our models consider a steady rate of vaccination while assuming that variants of concern are 50% more transmissible than the original variants. The projections suggest if all we do is maintain the current level of contact, we can expect approximately 400 cases daily by June the 1st. And if we open up and transmission increases by as little as 20%, case counts would be approximately 800 per day by early June. I am of the belief that there is little likelihood the facts will change sufficiently by May the 20th, when the current order is set to expire. I believe we cannot vaccinate our way out of this third wave, but that vaccination will be a powerful launch pad toward a more normal way of living after this wave passes. I believe vaccination can powerfully mitigate the risks of a fourth wave. I'm convinced that warm weather and the outdoors can be allies in reducing the spread of COVID-19 and give people more opportunities to do more outside as the weather changes. I very much want schools to reopen again. To leave the resolution of the pandemic to chance or to move too soon would be to follow the worst possible path through this pandemic. My peers and I don't want any kind of restriction in place for 1 minute longer than is necessary. But we have seen what happens when we rush to reopen. It always leads us to a resurgence of daily illness, hospitalizations, and ultimately, deaths. So we will be working towards a means to get everyone where we all want to be and what we have to achieve to protect it. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. I too would like to begin this afternoon by acknowledging that this is National Nursing Week. Never before has the essential role of nurses been more evident than it both has been and continues to be in response to the COVID-19 pandemic. Nurses are on the very front lines of the response to COVID-19, and we owe them a sincere debt of gratitude. On behalf of all of us, I extend a most sincere thank you to all the nurses who continue to give so much of themselves in service to others. The eligibility for booking vaccine appointments is determined by the Province of Ontario. At 8 o'clock tomorrow morning, the province will extend eligibility for COVID-19 vaccine to all individuals with at-risk health conditions, such as dementia and diabetes, as well as to Group 2 of people who cannot work from home, including grocery store, restaurant, and transportation workers. Information on the details for each of these groups of people are available on our website at toronto.ca/COVID-19. Today, the province also announced that on Thursday morning, eligibility for vaccine will expand to include all those who are 40 years of age and older. This week, our city-operated vaccine clinics will be operating at the highest rates of vaccine administration yet. Late last week, we made an additional 17,000 vaccine appointments available in city-operated clinics for this week, as a result of additional vaccine being made available to us. Accordingly, we are able to administer more than 98,000 doses of COVID-19 vaccine across the network of 9 city-operated clinics over the course of this week. The number of appointments that are made available corresponds directly with the number of doses of vaccine that are available to be administered. As of this morning, there were approximately 7,600 appointments remaining available this week. All city-operated COVID-19 vaccine clinic appointments can be booked via the online provincial booking system, which can be accessed from the toronto.ca/COVID-19 website. Appointments can also be booked via the provincial call centre by calling 1-833-943-3900. Of course, our ability to make vaccine appointments available and to administer vaccine in city-operated clinics is dependent upon supply. As of this morning, while our city-operated clinics are very close to being fully booked for a number of weeks, there are appointment times remaining available between today and June 13th. For the remainder of this week, our clinics are 92% booked. For the week of May 17, our clinics are fully booked. For the week of May 24th, our clinics are 99% booked. For the week of May 31st, our clinics are 95% booked. And for the week of June 7th, our clinics are currently booked at 53%, though we expect that will change quickly as eligibility expands across the province. Should the province of Ontario make additional vaccine available to us for any of these periods of time, we are able to open additional appointments to match. I remind everyone that in addition to the vaccine opportunities in city-operated clinics, our hospital and Ontario Health Team partners are also administering vaccines each day. Please go to vaccineto.ca for opportunities that may exist across their network of clinics. I also encourage those active on Twitter to follow Vaccine Hunters Canada for additional opportunities and information about vaccine outside of the city-operated clinics. Thank you for all you do to help stop the spread of COVID-19 in our city. And please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunization in Toronto. Thank you.
Thank you, Chief. We'll now go to questions. Just a reminder to please unmute yourself. We'll go first to Francine Copen from the Toronto Star. Francine, go ahead, please.
Hi, good afternoon. Dr. Davila, the Board of Health this morning called on the province to end the ban on outdoor recreational activities. Now, you've used Section 22 orders to take action in advance of the province at times, or instead of the province at times. And my question is, can you use Section 22 or any other orders to override the provincial ban on outdoor recreation facilities?
So Francine, an interesting question, one for which I'm sure I will want to seek legal counsel before opining on how best to use existing powers under legislation. My sense is that what we have been advised all along by legal counsel is that it is challenging to do such things as that, especially when there is provincial legislation at play. However, I do think that it's worth commenting on the fact that we are interested in continuing to collaborate with our partners, including those at the province, around how we support people in their ability to get outside and to take advantage of warmer weather, given that it is, coming, and that we know that outdoor activities are certainly safer, far less riskier in terms of COVID-19 spread and transmission compared to, say, indoor activities. And we also know, of course, that supporting people in their ability to get outside is good for physical health and for mental health, which I think we're all committed towards promoting and protecting to the greatest extent possible.
My second question is for Mayor Tory. Is there anything the city can do with regards to these outdoor recreational facilities? I mean, for example, could you deprioritize enforcing it? Is there anything the city can do?
Well, I think the city has been focused on large gatherings when it comes to enforcement and not so much on some of these other kinds of things. I think the city has taken a very active role, speaking of active, with active TO in opening up streets, and we will have a further opening up of the Lakeshore West this coming weekend so as to provide people with more opportunities to be outside in a safe way. And, the province has many things that they're worrying about, trying to get the schools open and things like that. And I think for our part that we're doing quite a bit in the context of making these active TO type opportunities available. And there are more coming in June. So we will continue to do that. And we will obviously continue our discussions with them about public health advice and other considerations that come into deciding what's best with respect to outdoor activities.
All right, thank you. We'll go next to Brian Passafume from the Toronto Sun. Brian, go ahead, please.
Yeah, good afternoon, everybody. Hope you had a great weekend. First question is in regards to a report published by the Canadian Taxpayers Federation today about how 99% of city employees got pay raises during lockdowns. I understand most of the workers in the city are under collective agreements, but I'm hoping somebody can comment on the decision during a time of cost cutting and belt tightening across the province of Canada, and scores of people out of work and forced to take pay cuts or salary cuts or hour cuts. The decision was made to go through with paying raises to, according to the CTF, over 4,600 non-union city workers.
Well, Brian, I can just say this. First of all, there were thousands of city employees who were affected in their work. Some took time out of work or were given time out of work that they didn't want to take out. Others were furloughed, and many others agreed to be redeployed to help in places like long-term care residences and even with vaccination clinics who otherwise might have had to take time away from work. The majority of our employees are covered by collective agreements, and so the raises that they were given were the raises provided for in those collective agreements. And the City Council passed in July of last year a motion that the management and accountability officers and other non-union employees would get a 0% increase in January of 2020. So I think that if you take that as against as well the obligation that we had and that we undertook, I believe, successfully in 2020, as we're doing in 2021, to continue to provide public services and to make sure that city employees were on the job and responding and doing the things that they do, because people did not expect all those public services to go away, then things have been handled quite appropriately, including many, thousands, who made a sacrifice of one kind or another that affected their work last year.
Okay, thank you for that. My second question is, I guess, for Dr. Davila. We've received reports that a second airport quarantine hotel, the Hampton Inn and Suites, is undergoing a rather nasty COVID-19 outbreak, one big enough that prompted Health Canada to quietly remove the hotel from its list of approved quarantine hotels for international air travelers. We're hearing reports that the hotel's been closed and the guests are being sent to other hotels. What, if anything, can you tell us about this?
So Brian, unfortunately, I'm not familiar with the specifics of that circumstance. Certainly happy to look into it offline and can close the loop with you thereafter.
All right, thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi, Dr. Davila. Just again on the motion that the Board of Health has put forward with outdoor amenities, there have been calls for the reopening of these areas for weeks now. Many people arguing, many experts actually arguing that they don't really make sense and didn't make sense in the first place. I'm just wondering why you're requesting this now when this has been called for quite some time. And if the province doesn't respond to your request, I know Francine was asking about Section 22 orders, but really, what is your message to residents? You know, many of them have already been ignoring the rules and using tennis courts and basketball courts. What should they make of it if the province says one thing and their doctor says another?
Well, you know, I think what we're all convinced of is that we're trying to do our very, very best from our respective seats, whether it's at the provincial level or here at the local level, to promote and protect the health of the people. Clearly for the provincial government, they're considering the broader health of the entire population. As far as I'm concerned, while of course I'm concerned of the health of all Ontarians, my primary obligation and focus is naturally the people of Toronto. And I would say at both levels of government, we would agree that you know, health does include the ability to be able to be outside, especially given that the summer season is so short here. And being able to engage in physical activity is good not only for physical health, but also for mental health. Of course, we are in the midst of a pandemic, and what we don't want to do is see people crowding or gathering in large groups of people. The mayor made some comment around that, but it's my sense that there is a way to try to support people in the ability to enjoy the outdoors, to enjoy the warm weather while it's here all too briefly, and to support their ability in optimizing physical health and mental health, even as we go through this stage in the pandemic and as we're trying to get people vaccinated. Again, that doesn't change the fact that there are still measures for self-protection that are required in order to reduce transmission risk. Transmission risk is definitely lower outdoors. I don't know that you can actually say that it's down to zero, but it's obviously much lower than it would be indoors.
And for all three of you, I'm sure you've heard the news of this commercial building party where a gathering of upwards of about 150 people were busted for having quite the get-together over the weekend. I'm just wondering, for all three of you, how do you react to this total disregard for the public health measures? You know, we've been into this 14 months now. Do penalties need to be increased? Are you worried that there are some people who may have had even one dose and have just thrown caution to the wind because they have that added protection now?
So, well, why don't I start off? I would say this. Obviously, we don't want to see people gathering in an unsafe way, and we know that the risk is definitely higher when you put a large number of people together in an indoor setting. We've come so far. But my observation, Matt, that the story being what it is, we have seen people really doing their very best to abide by the rules and to do their part to bring down the risk of COVID-19. As I mentioned in the remarks that I've just made this afternoon, we have seen more time at home for most people, and we've seen that since the emergency break and stay-at-home order came into place, we actually have seen a reduction in transmission. So, I would encourage people to follow that example, the example that's being set by the majority of Torontonians, which is to really practice those measures for self-protection, keep distance as much as possible so that we can reduce the spread of COVID-19, to get vaccines as soon as your turn comes up, so that we can get beyond this stage of the pandemic and start to return to that normalcy of life that I just described as well, that's happening in other countries of the world where transmission has been successfully brought down and where vaccination is at a level that allows for that greater flexibility and that higher degree of normalcy when it comes to activities of daily living.
I would just say, first of all, looking at the glass is way more than half full, that the vast majority of people are substantially altering their behavior and are staying home and are staying away, much as they don't want to, from their friends. And they should be the ones that should be the maddest about this kind of behavior, because this is slowing down in one way or another the process of getting to the blessed day when we can all get together again and go places we want to go and have the outdoor dining and so on. As for the people who did this, who are a tiny minority, I mean, $13,000 worth of alcohol is not a couple of people getting together for a beer. And even that is not supposed to be done if you don't live with the same person. So I don't know what planet these people are on. 37 people in this city, City of Toronto alone, died over the weekend from COVID-19. You need only watch the stories on television to see the terrible suffering people are going through, having to have lung transplants and not able to breathe and having to have intubation, and just terrible stories that are causing huge upset in families and, of course, having a huge ripple effect through the community, including with the economy. And so I don't know why people behave in this kind of a selfish manner, but they do. And the police gave some tickets, but they felt, perhaps a bit ill at ease, as sometimes will happen with a large crowd like that of people, kind of wading in to try and break it up. And so I don't know what to say, except that I just wish people would stop doing this, because it'll get us much closer to the day when we can reopen and have a party like that in a proper setting, in a proper way, and not contrary to the law.
Perhaps all I can add is just to echo what's been said, but also to acknowledge and to add my thanks to our Toronto Police and to our coordinated enforcement team members and officers who are charged with the responsibility of responding to situations like this. Like we have talked about in the past, those are challenging circumstances. They are dynamic situations that require the expertise and judgment of well-trained professional enforcement officers to manage that safely. I thank them for the fact that they exercised their best judgment and did their very best to protect the public health and safety as a result of that circumstance. I will just echo my colleagues in saying that all of the enforcement efforts that we have taken throughout COVID-19 have been for one reason, and that is to protect health and to get us through this pandemic as very quickly as possible. And circumstances like that and people making behavioral choices like that run counterproductive to the goal of putting this pandemic behind us and returning to all of the things that we missed so badly. So I'm disappointed to see that. I'm appreciative of our enforcement team officers for all the work they have done and continue to do.
Thank you. We'll go next to Janice Golding from CTV News. Janice, go ahead, please.
Hi, actually, my question was the same as Matt's. I just wanted to know how you felt about the fact there were 150 people gathered in this building, and they weren't wearing masks either, according to police. So it sounds like you've already answered that question, though. I just wanted to know, Dr. Davila, I mean, when you hear about 150 people not wearing masks like that and partying, how do you feel as a medical health professional knowing that other medical health professionals are putting their lives at risk trying to keep people alive.
Well, Janice, as I indicated in my earlier response, clearly that's not the kind of behavior that we want to see from a disease transmission point of view, or as you indicate, from the work that's being put forward by nursing colleagues who are celebrating Nursing Week, but all the other people working within the health system, public health and in health care. This is not the kind of thing we want to see. But I would echo again that the vast majority of Torontonians are indeed following the rules, are doing their very, very best as members of our community to try and reduce the spread of COVID-19 by practicing those measures for self-protection, by abiding by the terms of the stay-at-home order, minimizing their interactions with others wherever possible, and of course by getting vaccine as soon as their turn comes up. It's these kinds of actions that will actually get us to the other side of this pandemic sooner rather than later. You've heard my colleagues here talk about that, and I just can't emphasize enough how important that is. If that's where we would like to go, and if gathering again together in person is the kind of thing we want to be able to do as a community, but to do so safely, then the more we can stick to the measures for self-protection and the sooner we can support our ability for all of us to get vaccinated as quickly as possible, the sooner we'll get to the other side.
I just wanted to say, since you'd raised it, Janice, a word about the masks. I think if you look at the cities that are emerging from this now quite steadily, as we want to do, there's more prevalent mask wearing going on, and I hope people will be reminded of the fact that every chance they get, they can wear a mask, and I think that means inside and outside on the street. If you look at some of the pictures from places like New York, a lot more people, I think, percentage-wise, are wearing masks on the street. But if you take this instance and you add in all these things, 150 people, loud music, and I'm not against any of these things, but 150 people, which is not consistent with the law, loud music, $13,000 worth of booze, and no masks, you are only asking for trouble if one person goes into that setting that happens to be a spreader of this virus, and it's just a prescription for very bad news, including the mask part. They shouldn't be together to begin with if they don't all live together, which clearly they don't. But if you add the other things in, including no masks, this is a very bad news kind of prescription, which we've seen, and we've seen it over months many times, and we just don't need to see it anymore.
Did you have a follow-up, Janice?
I don't. Thank you very much. Appreciate it.
Okay, thank you. We'll go next to Mark Douglas from 680 News. Mark?
Thank you. I don't want to belabor the story about the big party too much, but I did have just one more question, just in terms of preventing this kind of thing from happening. Is there anything else the city can do? Are there any other options here? Do you have any more aces up your sleeve, or is everything that can be done in terms of preventing these events already happening?
Mark, I'll certainly I'll take a shot at least to start. I'm not sure what else can be done. We've been continuously clear. Dr. Davila and Toronto Public Health have been continuously clear about the public health risks associated with this type of behavior. These are already prohibited by law under the Emergency Management and Civil Protection Act. It is under those authorities that our Toronto police colleagues and our other enforcement team members needed to respond and needed to take action and lay charges. And those are very significant charges. That's a very significant piece of legislation. And frankly, I really don't know what else can be done other than to continue to reinforce, as we just heard Dr. Davila and Mayor Tory do, to reinforce the positive that so many of our residents are doing so well and continue to do so well under prolonged challenging circumstances. I have a deep appreciation and thanks for every single person that does. For the very small minority of folks that choose to violate the rules, I don't know what else to say other than those actions are directly prolonging our time in this pandemic. The fewer of these that happen, ultimately none of these things happening will minimize, will make the amount of time for which we all operate and exist under restrictions, will make that amount of time the shortest possible. So I would just really, rather than focus on the handful of folks that choose to violate the law, let's focus on the overwhelming majority of our residents who don't, who behave appropriately and who look after not only for their own health, but they look out for the health and safety of those around them, and my thanks to those.
Thank you. Then switching topics again to Dr. Davila, going back to the question of the outdoor activities, are there any specifically that you would want to see reopened? And do you have a priority list? The golf courses, tennis courts, basketball, is there anything that you believe should be opened sooner than other facilities, or is it just sort of get it all out and going as soon as possible?
So, you know, Mark, I would say that this is a subject that is constantly being discussed by a number of people working in the world of public health, including those of us at Toronto Public Health. I don't know that I have a very specific prioritized list, but clearly we are interested in collaborating with our partners across the province, including the province themselves, to see what we can do about increasing the opportunities for people to enjoy the outdoors. As I said, while the warm weather is here, we know that's all too brief, but we also know that there's a real opportunity to use the outdoors and use the warm weather, as I mentioned earlier in my remarks this afternoon, as allies to help us support people in enjoying better physical health, enjoying better mental health, and at the same time doing it in a way that reduces the spread of COVID-19. So again, I don't have a specific list prioritized at this point in time, but know that we are actively discussing this issue on a pretty regular basis.
Thank you. We'll go next to Oliver Moore at the Globe and Mail. Oliver, go ahead, please.
Good afternoon. My question is about the Toronto Maple Leafs getting vaccinated. I'm hearing some concerns from within the medical profession that they don't appear on the paper, or it's not obvious that they're eligible. They're generally speaking under 40. They don't work in a hotspot. They don't live in hotspots. Can you explain to me by what criteria they became eligible for this vaccination? And also comment on what looks like a remarkable unfairness that a bunch of pro athletes got vaccinated ahead of, say, transit workers or grocery store employees.
So Oliver, thanks for your question. I would say this simply, that looking at the criteria, they do meet. They are eligible, in fact, whether it's through age, through hotspot, and in fact through, all the criteria that the province has put out thus far in respect of eligibility. I think the other interesting thing that one has to look at is the fact that there is some work-related travel that is part of their future. And certainly we don't, given the nature of the work and given the nature of their exposure to other individuals, there's certainly risk. So I'm pleased to see them get vaccinated, and I'm looking forward to ensuring that we're providing vaccines to as many people as possible, including all those other essential workers that you talked about. There is no question. We have been working very, very hard over the course of the past several weeks to ensure that all those who are at risk and who are eligible are getting vaccines as quickly as possible.
You talk about them traveling for work. Are there any other a lot of people travel for work. Are there any other professions for whom traveling for work gets them moved up the vaccine list?
Well, it's not a simple question of just travel. You have to think about as well where the travel is and the nature of the exposure. And when we look at the nature of the exposure for those who work in this realm and who are up close, the nature of their work is such that you're up close and very in the personal space, if you will, of lots of other people. I would further point out that within the realm of professional hockey and some of the minor leagues as well, there have been challenges with respect to COVID-19 outbreaks, and that's certainly not the kind of thing that you would want to see amongst this group. So, again, eligible, have risk conditions in place, workplace travel that is associated with the work, and so very pleased to see that they were able to access vaccine, demonstrate that leadership, and really looking forward to make sure that all other people get vaccinated as quickly as possible.
All right, thank you. Our final question is to Adrian Gobriel from City News. Adrian, go ahead, please.
Hi, question for Dr. Davila. Flipping the topic to summer camps. In the GTA, Toronto specific, lots of families have somewhat resigned to the fact that schools might not be opening before the end of this school year. Lots of families looking ahead to summer camps, trying to plan. There's lots of private camps trying to plan. Understanding that you take your direction on this from the province before making a more local announcement and decision, Have you heard anything from the provincial government when it comes to day camps specifically in Toronto? Do you believe it's a matter of if, rather a matter of when, not if? And if the province was to move Toronto into the gray zone and camps could open, are you on board to support the opening of day camps?
So, this is a question that is still very much an active discussion. I don't have specific details to share at this point in time, but my understanding is that there are conversations happening, amongst public health officials across the province, and certainly public health officials at the provincial level are also part of those conversations. I don't think there's any question that people are interested, public health officials are interested in trying to provide as many opportunities as is possible. We recognize that, online learning or remote learning has been, is challenging, and we'd like to try to see children get opportunities like camp, given the many benefits that has for their health as well. But of course, it all has to be balanced, as it always, as we've tried to do throughout the course of the entire pandemic. Balancing COVID-19 risk and protections against the other health benefits associated with the activities in question, in this case, camps and summer camps. So still much conversation that has to occur. Lots of interest in trying to support the ability for children to have those great opportunities that come from camping experiences. I'll look forward to sharing details as those details become available, and certainly we'll be working with other health units around the province and of course the province themselves on this important issue.
And Brad, may I just add to that, without presuming upon what the advice will be from the medical officer of health or from the province for that matter, our city staff worked really hard last year to find ways to conduct summer camps safely. And they made huge changes to how those camps were operated and made opportunities available for thousands of kids to participate in those camps safely. And so I will just say that the City of Toronto staff, who are really good at this, will find a way, if there is a way, to make sure that those opportunities can be provided to kids, because they've suffered being kept apart from their friends and so on for so long, and a lot of parents and kids need these kinds of activities in the summer. So within the constraints that may exist, they'll be using the same creativity and ingenuity they did last year to try and make anything happen that can.
Thank you both for your answers on that. When it comes to overnight camps, obviously the City of Toronto doesn't have a lot of overnight camps, but lots of kids from Toronto, if overnight camps were granted, would be leaving the city and going to an overnight camp into a cabin where a child from Peel region might go and be in, and one from Durham and one from London, Ontario, all over the province. Are there concerns when it comes to overnight camps for the City of Toronto that children from different regions could be sharing the same cabin and then going back to their respective regions? Are there concerns about perhaps overnight camps running up right until the hopeful reopening of schools in September? And perhaps Dr. Davila, is there like a threshold or a mark that you want to see from a public health standpoint before we can say, okay, we're good to go for overnight camps?
Well, I think you're already implying that there are some concerns naturally. You have people coming from different parts of the province and maybe even beyond, and mixing together in groups of people in an indoor setting. These are the kinds of things that we know give rise to the risk for transmission of COVID-19. And nobody really wants to have their camp experience, marked by something like a COVID-19 infection and all the consequences that may arise as a result. So obviously, I think there will be, a lot of conversations. This is exactly why there are many conversations happening right now around what makes the most sense. And we will be looking, as you might appreciate, from a public health perspective around, so what does transmission look like? And what conditions might there be that would give rise to a more safe operation or a reasonably safe operation of camps, whether they're day camps or overnight camps? Still very much in the discussion phase. I realize we're getting close to camp season, but please know that people are working on this and discussing this very actively, recognizing that this is a much valued and important part of childhood for many, many people. So we recognize its importance. having the conversations. And I would just ask that you and others stay tuned as we're working our way through the particulars on this one.
I thank you very much. That concludes today's briefing. Our next scheduled briefing will be this Wednesday, May the 12th. Please stay well.